Some histology. You love histology?
Yes, sir. No, sir, we don't.
You don't like. So first of all, we have to remember histology. So today we talk about liver disease, so we'll remember liver histology.
Yes, sir.
Liver. So do you remember what is structural, morphological, and functional elements of liver?
Hepatocyte. No.
Hepatocyte, that's cell. So that's cells of liver, but that's not
Structural
functional
and
element.
functional unit of
What does mean functional element actually?
parenchyma. No. Tissue one.
Supporting element.
Cells.
So
Triad of
morphological functional element, that's one element of several cells that can do some functions. One hepatocyte don't do any function, that's one
combination
single
of.
cell. So morphological and functional element, that's some number of cells of parenchyma of stroma that do function. Okay? So what is morphological and structural functional elements of the liver?
Hepatocyte.
Lobules,
Lobules.
right,
Yes.
lobules. Liver lobules. What is that?
Consists of many hepatocytes.
How many hepatocytes?
Maybe 320.
No, it's too much.
I mean, lobules. That's not anatomical, like two big lobes. Not these lobes. That's little lobules from the histology. So what is lobules? That is
Hexagonal shape.
Huh?
Hexagonal shape.
Yes,
that's
hexagonal
better.
cells.
So what is functional element? That's central vein,
Arteries.
line of the hepatocytes,
Por do.
and the triad of liver at the periphery.
Yes, sir.
That is morphological element. So that will be like, yes, that's hexagonal shape. So that will be more and more. So that's morphological element of the liver. Central vein, hepatocytes. So that's more like several lines of the hepatocytes and triad of liver. Remember what is the
Triad of liver, yes.
What's that?
Arteries, veins, and cystic
Artery vein
and ducts. Lymph. No, not cystic duct.
what duct?
Bile
Right,
ducts.
that's
Cystic duct.
artery. That's vein. Which vein actually?
Hepatic vein. Hepatic portal vein.
That's a terminal element of vena
Bhai, yaar,
porta.
kitna
Artery,
तेज जा रहा है
vein,
अभी.
bile duct. That's triad of liver. And triad of liver, hepatocytes and central vein. That's morpho-functional element of the liver. This thing can do function. Only one single hepatocyte don't do any function, but this thing do function. Okay. So what do we have to understand about why is that important? There is such disease as cirrhosis. What is the cirrhosis of liver?
Cirrhosis is like sclerosis.
Yeah, in this case we see overgrowth of connective
tissues.
But in case of liver, that's not the only one. In case of liver, that's very big and problematic moment. Liver is a unique organ which can regenerate greatly. So we can delete part of the liver and we get this part again. So it grows same as the tail of the lizards. That's unique organ. Hepatocytes can proliferate, differentiate, and we get more and new hepatocytes. That's unique organ. But in case of cirrhosis, this regeneration is problem of this organ. Actually, cirrhosis, that's very specific for the liver, right? That's we don't usually talk about cirrhosis of kidneys, right? So why? Because of hyperregeneration. That happens because of regeneration of the liver. If liver couldn't regenerate so much, we didn't even never get cirrhosis. So what happens? We get some damage to the hepatocyte, for example, in the center. This hepatocyte dies. Because of the necrosis of the hepatocytes, it gives signals to other hepatocytes, and they start to proliferate. And instead of one hepatocyte, we get 10. We get 10 hepatocytes. So it was one hepatocyte, now we have some kind of this picture. Actually, this is blood, this is bile. So this is from the adenoids there is blood. So this hepatocyte connects with the blood. From this side it connects with the bile. So from this part they get all toxic substances, they get oxygen from this part. So this they secrete, they secrete bile here. Okay? Okay. Actually, which type of blood is that? Arterious or venous?
Arterial.
That's mixed blood. That's unique organ. Hepatocytes supply by mixed blood. Again, there is artery and vein together. They give
आर्टरी तो
here,
नीचे है ना
and blood is mixed. So there is two functions. From artery to from arterial elements of this blood, they get oxygen. From venous blood, remember, from all gastrointestinal tract, blood goes to the liver, and that's it. From the venous goes blood here to the liver, and all toxic substances that we need to delete, they go again from here, from this mixed blood. And this is bile. They produce bile. Okay, that's normal. But as you can see, in this case, there is overgrowth of the hepatocytes, and these hepatocytes in the center don't connect with the blood, don't connect with the bile, right? So this hepatocyte don't get oxygen. So of course this hepatocyte will die. Of course this hepatocyte will die. And we get again necrosis in the center, and instead of one hepatocyte, we get 10 more. So more and more.
इधर मिक्स
More hepatocytes, we get such picture. Central hepatocyte don't connect with the blood, they don't get oxygen, they will die. They die, they give signal to other hepatocytes, and we get more hepatocytes, more hepatocytes, and more hepatocytes. And after time, we get such of this structure. So you remember, morphostructural elements is a central vein, line of the hepatocytes, then triad of the liver. It doesn't look the same, right? So it was morphofunctional element, it was doing some function. In this case, there is no any function. There is chaotic structure. It can't get detoxification of the blood, it can produce bile. So in this case, there is damage to the function of the liver. This part, I pay attention, that hepatocytes in this case are normal. Hepatocytes are same as always, hepatocytes are normal, but because of the structure of the hepatocyte, they can't work. In this case, they don't work. So there is decreasing of the function, this part don't work, and that whole name of this thing is lobule regenerate. So regenerate lobe, pathological regenerate. This lobule don't work at all, and that is pathogenesis of cirrhosis. So damage to some hepatocytes, they overgrow. Because of overproduction of new hepatocyte, there is damage to the structure and the livers don't work. So unique feature of the liver, regeneration, that's because of this feature we can take parts of the liver to the transplantation, we get new parts. So same unique feature, regeneration, give us cirrhosis of liver. Get this? Yes. Great. Okay, one more moment. So central vein, the line of the hepatocytes, then triad of liver, artery, vein, and bile duct. We can get this pathologic, two huge hepatocytes for a moment. Have to be a bit smaller. Okay, hepatocyte. We can get this pathological process at the periphery or in the center. So that will be periportal cirrhosis or pericentral cirrhosis. When it happens, so imagine that we have chronic hypoxia. So because of some heart disease, lung disease, hematological disease, there is chronic hypoxia of the liver. In which case, so in this case, we will get periportal or pericentral cirrhosis. Chronic hypoxia of the liver.
Central
So it is peripheral.
Peri what?
Central.
Pericentral or periportal?
Central portal.
Periportal is here, pericentral is here.
Periportal.
Periportal, why?
So
Because
that means artery is locked. Blood
And
will not go
what?
there.
Huh?
Blood will not there.
blood will not. अरे
The
क्योंकि
there will because of artery, sir, I think.
Because of heart. So, explain why.
अरे क्योंकि ना आर्टरी
Pericentral, why?
सर वन सेकंड क्वेश्चन सर
We have chronic hypoxia of the liver. Because of heart, because of lungs, all that's chronic hypoxia of the liver. We will get cirrhosis of hypoxia. The cells will go to the cells will sometimes they will die. So because of this, there will be hyperregeneration, and we will get that's periportal or pericentral. Where? Here or here?
Sir, because artery carried
Near the
oxygenated
arteries,
blood.
no?
So there will be no oxygen. There will be
there will be
Sir, can it be
hypoxia.
at both locations?
After some time it will be. After some time it will be central.
Usually starts with one localization.
First,
Pericentral, why?
near the arteries,
It will
because
move from pericentral to periportal.
Okay, in this case, in case of chronic hypoxia, that will be here, pericentral. That will be here over regeneration. Why? Chronic hypoxia. We get oxygen from the artery. So oxygen goes here, then here, and there is not enough. So for this hepatocyte, there's still enough oxygen. Because we get, yes, for this hepatocyte, there's still enough. For this, maybe enough, but for this, there's not enough oxygen. They will die. And we will get pericentral cirrhosis.
first pericentral.
Yes, in case of chronic hypoxia, that will start with pericentral. Of course, then it will go to all parts, but in case of chronic hypoxia of the liver, that starts with pericentral cirrhosis. Okay? You get this? Great. And what happens, for example, in case of chronic intoxications, like alcoholism? That will start with pericentral or periportal?
Periportal.
Why?
Because the veins
Arteries.
is open.
Because intoxication starts in the lower.
Okay. So, some alcohol,
First
again,
damage
function
the
of the liver is detoxification. Alcohol will destroy, so alcohol will eat some of the hepatocytes during necrosis. It will kill some of the hepatocytes. And again, alcohol goes from the vein, from the gastrointestinal tract, right? So from the vein, alcohol kills this hepatocyte damage, and this hepatocyte are safe because this hepatocyte take all alcohol. So yes, we'll start with
peripheral to the central.
Again, in case of chronic hypoxia, that will be pericentral cirrhosis. In case of
Chronic
intoxications like drugs, alcohol, poisons, that will be periportal. You get this?
Yes.
Great. Liver dry. Okay. What is liver disease? That will be hepatosis, hepatitis, cirrhosis, and some tumors. We start with such thing as anti-toxic liver dystrophy. So, in the name of this is liver dystrophy, but in pathogenesis that is necrosis. So that's some like little paradox. In name we see dystrophy, but in pathogenesis we see necrosis. That's acute disease with massive necrosis leading to acute liver failure. Why it can happen? Because of some food and industrial poison, alcohol intoxication, past or fulminant form of viral hepatitis, cystitis, and steatosis. So there is two stages, stage of yellow dystrophy and stage of red dystrophy. In case of stage of yellow dystrophy, why yellow? Because in this case we still see dystrophy. There's accumulation of the fat protein, so we see parenchymatous fat dystrophy. But then there is, we see those fat proteins go to the detritus, and why it's the stage of the red dystrophy? Because sinusoids and lobules will be full-blooded. So in first stage that's yellow because of parenchymatous fat dystrophy, then because of full blood of the sinusoids and vessels and the lobes, we see that's red dystrophy. Clinically we see liver failure. If the patient survives, so again that's acute situation, that's dangerous situation. Patient may die because of this, because of acute liver insufficiency. If the patient survives, that will be post-necrotic cirrhosis and chronic liver insufficiency. That's how it looks at the stage of the yellow dystrophy with fat dystrophy. Same. We see yellow dystrophy in form of the fulminant hepatitis B. That's red dystrophy, so we see full blots of the sinusoids and the capillaries. So what we see in case of acute liver failure? We see jaundice, decreased liver size, encephalopathy, hepatorenal syndrome, hemorrhagic syndrome, increase of activity of biochemical indicators like the serum transaminases. Outcome will be liver cirrhosis post-necrotic or acute hepatic or hepatic renal failure. Okay. So in this case we have to remember what is jaundice.
Like
Bile is not
dysfunctioning of liver.
bile expel out.
Like
The body, the blood.
when there is excess bilirubin and biliverdin in the body.
Bilirubin.
And
That's
biliverdin.
the combination of the bilirubin, not bile. Which types of jaundice you remember?
Hemolytic jaundice, mechanical and
Yes.
submechanical. Three type of jaundice.
Which type of jaundice will we have here?
मैकेनिकल ना हिपैटिक
Post hepatic. Why
मैं
post hepatic?
मैकेनिकल से ना
Pre-hepatic. Why pre-hepatic? What?
मैकेनिकल होता है मैकेनिकल
पता नहीं मुझे मुझे क्यों पूछ
Hemolysis.
रहे हो?
I said hemolytic jaundice.
Where is hemolysis?
hemolysis is not there na
Hemolytic syndrome.
That's damage to the liver. Where is hemolysis?
no hemolysis no hemolytic jaundice it is not
Triad.
sir it is a
Huh?
Triad.
Hepatic. Why hepatic?
dystrophy हो रहा है ना येलो
Okay, what does mean pre-hepatic jaundice? What
pre-hepatic
does mean
jaundice
pre-hepatic jaundice? And
before after that there is a breakdown
Actually,
hemolysis and there's a hepatic
for what do we need? How do we get bilirubin?
from spleen like no अरे स्प्लीन में वो डैमेज होता है तो फिर वहाँ से आता है
Я уже объяснил.
अरे मैं स्प्लीन इसलिए बोली हूँ ना कि आरबीसी को वहीं तोड़ के बिलिरुबिन
Why do
बिलिरुबिन
we get
बनाते हैं
bilirubin actually?
ड्यू टू मोर
Breakdown of what?
hemoglobin
Okay, that's right, hemoglobin.
that is generally
How do
happen
we need hemoglobin?
from spleen as we know no
Okay, so in which cells it happens? Hemoglobin.
erythrocyte cells
Destroying of the erythrocyte, destroying of hemoglobin, and we get bilirubin. That's how we get bilirubin mostly. And then that will be metabolism of bilirubin, but we get it from the erythrocytes. So that is what about prehepatic jaundice. That is hemolytic jaundice. Pathological hemolysis, we get too much bilirubin and we get jaundice. That's accumulation of bilirubin everywhere. That's prehepatic. What is hepatic jaundice?
hepatic jaundice जब वो hepatic cells में
okay.
it
There
can
is destroying of the hemoglobin and we have bilirubin. What's next?
then it spread to the
So overstructure like.
No, in normal, not in pathology. What happens with the bilirubin next?
it distributed it destroy the function of hepatocyte cells है ना
To what?
अरे बिलिरुबिन बिलिवर्डिन
That's more to the end, but what happens? Okay, there is destroying of the erythrocytes, usually in the spleen.
spleen नहीं वही तो बोले
What's next?
after that it destroy the it accumulate in the hepatocyte cells and
Okay, it goes to the liver.
liver yes
To the hepatocytes.
It's-
What's next?
then it destroy the function of hepatocyte cells
No,
not destroy okay
No, not pathology. Bilirubin goes to the hepatocytes. What's next?
Structure changes. Back must be some. वो था ना वो बाहर से
more
What hepatocytes do with the bilirubin?
bilirubin it change into bilirubin
There is process of
conjugation
conjugation.
So there is a biochemical, you remember, reaction in hepatocytes. That's a reason to make bilirubin non-toxic.
okay हाँ yes detoxification
Detoxification and the reaction of the conjugation. And we get from one type of bilirubin, like non-direct, we get direct bilirubin.
bilirubin
Yes. What's next?
bilirubin after that it goes to gallbladder and is
So hepatocyte did all these biochemical features with bilirubin. What's next?
then it goes to gallbladder and
Okay, it's secretion to the bile. Not gallbladder, that's just organ for the accumulation.
Storage,
That's
yes,
it. It
storage.
don't take part in the metabolism. That's
Okay,
like
okay.
some sac for the accumulation, and that's it. So yes, secretion of the bilirubin to the bile, and that's it. Then to the gastrointestinal tract, and with the fecal masses goes away, parts reabsorbed. But okay, that's metabolism of bilirubin. If we have some, we have mostly three levers. Before liver, with the spleen destroying of the erythrocytes, liver metabolism of the bilirubin. Then
After that, in the
at the bile tracts. We have damage of some of this lever, we get jaundice, and that will be prehepatic, hepatic, or
Subhepatic.
hepatic jaundice.
सब हेपेटिक मैकेनिकल होता है ना लास्ट
In case of You understand this?
Yes.
Great. This is post-hepatic. Why?
Only.
Because it prevent the excretion of bile into intestine.
मैकेनिकल होता है ना पोस्ट हिपैटिक.
Because bile is affected.
भाई ये तो मेरे को भी नहीं आ रहा है.
Because the bile is affected. Hepatic होगा hepatic.
उसने बोला पोस्टोपैथिक है क्यों है?
तुम लोग क्या बोले थे इस पे लिए?
मैं कुछ नहीं बोला शांत
बोलने नहीं.
आज पूरा शांत
Sir, question once more, sir.
Yes, sir, we understand.
We understand.
Okay.
You are also
We
bad
have
at drawing.
3 levels. Pre-hepatic.
sir.
Hepatic and post hepatic.
What is pre-hepatic level of jaundice?
Hemolyze.
Hemolyze like in this
First of all, one moment. We
breakdown of RBC into the spleen.
pre-hepatic, hepatic, and post-hepatic, but in all these 3 levels, doesn't matter where we see jaundice. That will be jaundice in different color. In this case, more green. In this case, more orange. But still, we see jaundice. The patient will be jaundice. Eyes will be yellow. Skin will be yellow. That's different extra colors of the yellow. That's more green, more orange, but the patient will be yellow. So if we see problem in any of these, we see jaundice. Okay? Okay. What is pre-hepatic? Hemolysis.
Hemolysis.
We have erythrocytes here. Some of the erythrocytes, when they die, we get too much bilirubin. Liver work normally. Bile tracts work normally.
Normally.
So damage to the erythrocyte, too much bilirubin. Bilirubin accumulates in the tissues. The patient is yellow. That is pre-hepatic. That's not damage to the liver, not bile tract. That's damage to the erythrocytes.
Erythrocyte.
That can be mostly that's autoimmune, some poison, some intoxication that's called hemolysis. So we get hemolysis, destroying of the erythrocytes. Okay. Okay. For example, the previous semester we discussed lympholicosis, lympholichemia. In this case, we get antibodies to the erythrocytes. They cause hemolysis, and we get hemolytic jaundice. That's pre-hepatic jaundice. What is hepatic jaundice?
In this case, like
But liver involved.
problems in the bilirubin metabolism.
When bilirubin is not
Metabolism.
converted into the bile.
It can be
Why?
there is no detoxification of bilirubin.
So yes, that's problem with the metabolism of
Metabolism of
and
bilirubin in the liver.
level of the liver. But why it happens?
More amount of bilirubin.
No, that's it. More amount of
Damage of
bilirubin.
hepatocytes.
In this
Yes.
in case of liver, amount of the bilirubin is normal. So we talk about liver. There is no pathological hemolysis. That's normal hemolysis. So why?
Because it destroys the metabolism.
So yes, that destroys metabolism. But why it happens?
अरे क्योंकि
What can make problems for the metabolism of the bilirubin in the liver?
Hepatocytes damaged.
That's right.
Damage
Damage to the hepatocyte. Doesn't
damage.
matter why. So, damage to the hepatocytes. In case of hepatic jaundice, we get damage to the liver. Liver don't work. So bile tract is normal, hemolysis is normal, but liver don't work. There is no any metabolism of the bilirubin. So bilirubin after decay of the erythrocytes accumulates here, nothing, and accumulates all over the body, and we get jaundice. That's hepatic jaundice, and that can be any damage to the liver. Intoxication, some direct damage like knife in the liver, so anything. Sepsis? You said sepsis?
Yes.
Sepsis mostly.
Atrophies. Atrophy
Sepsis
can
different
be.
story. We'll talk about this later.
Atrophy.
In sepsis we can get these 2 types, but usually the patient will die before we get jaundice. Okay. So that's hematoma of the liver, abscess of the liver, some parasites like echinococcus of the liver, so anything that damage to the liver. Hepatocytes don't work, no metabolism of bilirubin, bilirubin accumulates. You remember we discussed pathological lobules regenerate, right? So that's a cirrhosis of the liver. That's normal hepatocytes, but they can't work. That still we will get hepatic jaundice. Okay. And that's hepatic and post-hepatic, that is obstruction of bile tract. So these elements, it was normal, so it was normal decay of the erythrocytes, hepatocytes work, the portion that's decay, then they produce bile. Bile stops here, can't go further. So bile accumulates in the bile ducts of the liver, accumulates here, start to go to the blood flow, and we get bile all over the body, and that will be post-hepatic jaundice. Okay.
All over the body.
Which type of the jaundice we have here?
Acute toxic liver.
What's that?
It can be hepatic.
Hepatic.
Acute yellow
Why hepatic?
dys-
Because destruction of the
yellow dystrophy.
Hepatocyte did not work.
That's right.
Yes.
We talk about liver disease. That's our today's topic. So, of course, in this case, in case of what we'll discuss today, we talk about hepatic jaundice. That's damage to the liver. Hepatocytes don't work and we get jaundice. That is normal decay of the erythrocytes, normal. And there is nothing in the bile tract. So in case of all liver disease, we get hepatic jaundice. Okay? What is that, hemorrhagic syndrome? Hemorrhagic syndrome, what is that?
There is bleeding.
Increase in the vascular flow.
destruction of vessels.
फ्लो लाइक क्या होता है
Hemorrhage क्या ही होता है? Rupture.
What do we
Accumulation.
get in clinic?
Bleeding.
Bleeding.
That's different types of bleeding. That can be big bleeding, that can be just nose bleeding. So we get patient that says, like, doctor, every 2 days I get nose bleeding, that's very hard to stop. That's hemorrhagical syndrome. So pathological bleeding. That can be small bleeding, like from the nose bleeding. That can be big bleeding, like in the joints and others. Okay, in case of acute liver failure, we get hemorrhagic syndrome. Why?
Acute liver failure.
Maybe that's a mistake. Maybe we don't have hemorrhagic syndrome in case of acute liver failure. So that's actually an interesting idea. Do some mistakes during the presentation. Okay, hemorrhagic syndrome. Do we have this in case of acute liver failure?
Why not?
Yes.
अभी हो सकता है ना acute में.
Why?
No.
Hepatic portal, that's not symptoms of acute liver failure.
ज़्यादा लोड हो जाएगा तो हेपेटोसाइट डैमेज हो जाएंगे.
So, okay, first of all, do we have hemorrhagical syndrome in case of acute liver failure?
Yes, sir. No, sir. Yes, it can be. Yes. 100%.
As it's written here, we have hemorrhagical syndrome. But how?
Because clotting factor, impairment of the clotting factor.
What with the clotting factor?
Maybe the clotting factor is not working properly.
Clotting factor नहीं होगा तो
What with the clotting factors?
hepatocyte produce clotting factor.
That's right.
Yes,
All
and if it
clotting
is
factors except
except
thrombocytes we get from bone marrow.
Bone marrow.
Non-clotting factors like
From the liver.
others produced by hepatocytes. All like protein clotting factors produced by hepatocytes. Hepatocytes don't work, no clotting factors, and then we get hemorrhagical syndrome.
So why
encephalopathy.
why do you get encephalopathy?
Encephalopathy.
Thank you. What is the encephalopathy?
It's
What is the encephalopathy?
अरे ब्रेन में कुछ है ना.
किसी का तो पता है.
Yes.
So that's some damage to the brain. That can be some through the encephalopathy. That's a very common term with plenty different types of clinic. This can be neurological clinic, psychiatric clinic, like coma, like psychosis. So that can be plenty of things. Why it happens? Okay, so what is encephalopathy? That's some damage to the brain. Why it happens in case of acute liver failure?
Maybe cross the blood-brain barrier.
The hormones कौन सा कमी रहता है?
Sir, many hormones is. Sir, liver detoxify all the things which we eat, like from the intestine to the liver it goes, then detoxification, then enter to the other organ. But if there is damage in liver, then toxic will reach to the brain and maybe there will be damage.
That's
Something.
right. That's right. Our intestine don't understand. We need this or we don't. Our intestine just absorb everything. Absorb foods like carbohydrates, fats, proteins, absorb everything and also absorb products of the metabolism of the bacteria. Our intestine absorb absolutely everything. Intestine don't know. We need this or not. Then everything goes to the liver.
Liver.
You remember all the blood that we take from the intestine, we pour to the liver. During the problems of the digestion, all the things that we absorb, we reach to the liver. Liver are some of the just fats and some of the things liver detox. Liver destroy products of the metabolism of the bacteria, some toxic substances, because we don't need this. That's dangerous. We discuss acute liver failure. Liver don't work. And all toxic substances that we always eat, so not eat, we always absorb. Mostly because of the metabolism of the bacteria and decay of the proteins. All toxic substances avoid liver because of the liver failure, the liver don't work, and right to the brain. And then we get encephalopathy. Okay.
Answer.
Then we move to fatty hepatosis or hepatic steatosis. That's a chronic disease characterized by increased lipid accumulation in the hepatocytes. So in this case we see fatty dystrophy. By etiology it can be chronic hepatotropic intoxications like alcohol, medications, hypoxia, leukemia, alimentary factors, endocrine disease. Pathogenesis, that will be for that we discussed the previous semester, so the same for infiltration, composition, transformation, abnormal synthesis. Remember, mechanisms of dystrophy is great. So that's fatty hepatosis. On the left, liver is normal. On the right, that's liver of alcoholic. Fatty hepatosis. You see difference?
Yes, one is red,
Because
one is yellow.
pathological lipid accumulation. That same fatty hepatosis. That is
Sudan
fatty
test.
hepatosis.
Fatty Sudan
So
test, no?
where is fat?
The big white is fat.
Which, bless you, which stain is that?
Sudan. No. Oh, no. Special hematoxylin and eosin. For the pink. No.
If we use hematoxylin eosin, what's the color of the fats?
Colorless,
Why you don't
white.
take hematoxylin, don't
Yes,
take eosin.
due to
So
colorless.
all the white zones you see, that's fat accumulation. You see, that's obesity of the liver. Plenty of fat accumulation, parenthemal fat dystrophy. So we take slides of the liver, we stain with hematoxylin eosin, and we see such picture. So we can be sure that's fatty dystrophy, right? Can be what?
Nutmeg liver?
That's
Yes.
possible, that's hydrophic dystrophy.
Ah,
So we
hydrophic,
see pretty
yes.
similar picture. So white zones in the cells. How to understand, that's fat or hydrophic?
Yes, Sudan 3 will be done. If
What
it
we
is
will
a
see?
orange color, so it is like
That's right. In case of Sudan 3, we see orange color. So that's not very orange, but that's orange. So in case of Sudan 3, we see orange color. And in this case also, that's most happens in the alcoholism, so fatty hepatosis mostly about alcoholism. Also we see parenchymatose protein dystrophy of alcoholic hyaline. You remember specific name of alcoholic hyaline?
Mallory.
Maillary corpuscles. Which mechanism of maillary corpuscles? Mechanism. So there is four mechanisms: infiltration, decomposition, transformation, abnormal synthesis.
Infiltrate. No. Abnormal synthesis.
Abnormal synthesis. We don't have alcoholic hyaline normal at all. So we get absolutely unique protein, abnormal synthesis. Okay. Fatty hepatosis, that can be accumulation of the triglyceride, can be dusty and of course dropped by volume, that can be disseminated, zonal and diffuse, by localization, central, locular, and pericordial. Hepatitis. What's hepatitis? So you see particulitis, that's inflammation, right? That's diffuse inflammation of the liver manifested by both dystrophy and necrosis and cellular infiltration. So we see three features: dystrophy, necrosis, and leukocytic infiltration because that's inflammation. Can be primary, secondary, by course can be acute and chronic. By etiology, that can be because of viruses of the hepatitis, all types, drugs, alcoholics, autoimmune, hereditary, cryptogenic, and mixed. What does mean cryptogenic? Cryptogenic.
Hereditary and cryptogenic.
क्रिप्टो कॉइन को तो सर
अरे नहीं पता है मुझे हेरिडिटी एंड क्रिप्टोजेनिक लेकिन ब्रेन में कुछ होता है ना ब्रेन से हेरिडिटी ड्रग अल्कोहल ऑटोइम्यून हेपेटाइटिस क्रिप्टो सम केमी मे बी
Cryptogamy means disease of unknown origin.
Chemical
That's right, unknown origin. It's actually,
unknown origin.
unknown origin. So,
कार
same
देखे
story
भाई
as,
क्रिप्टोजेनिक.
Idiopathic. Same story as idiopathic, sir.
yeah, so cryptogenic, that's unknown etiology, and that's diagnosed, so we see hepatitis. First of all, we find some viruses, then we think about alcohol, drugs, then we think about autoimmune, and if all are minus, so we check for everything and there is nothing, then we call that cryptogenic hepatitis. Like we don't know, that's just hepatitis, we don't know why. So that's the,
So we can call also idiopathic or
that's
idiopathic.
right.
Yes. Meta, also called meta.
Okay, forms of viral hepatitis
Idiopathic मेरे को पता है.
can be jaundice-free, psychojaundice, necrotic, and cholestatic.
It is also called meta.
Forms can be chronic persistent and chronic, active or aggressive. There is stages of the acute hepatitis, that's incubation, prodromal, jaundice period, and outcomes that will be full recovery, colonization, virus carrier, and lethal outcome. I suppose that's the microbiology you discussed, so that's for you just to remember. You remember differences between co-infection and superinfection?
Yes.
Yes, sir.
Co-infection is like
Co-infection
vitamin like
together.
hepatitis B and D is on the same and superinfection is like. कहाँ मैंने उधर नहीं देखा मैं सर की तरफ देख के बोल रहा हूँ.
In we can see central lobular necrosis. So, a bit quiet please, for the desk. Quiet. So, you remember that we discussed central lobular and periportal. So, central periportal or central lobular, that's the same. So, that's same about story about necrosis. So, in case of viral hepatitis, that will be central lobular anti-macro. That's submassive hepatic necrosis in the form of fulminant hepatitis B and D. What does mean fulminant? Fulminant. What does it mean?
It can be like. It look like a puffy.
What does mean fulminant?
Swelling.
Fulminant means very fast, very aggressive course.
Okay,
So
very
fulminant
fast.
form, that's when they like patient with hepatitis like burn maybe. So fulminant, that's very common form. That's not only about hepatitis. So that's mostly about infectious disease. Fulminant form of infectious disease. That's when the disease is very active, very aggressive. Like some small period of time and the patient dies. That's fulminant form. Very aggressive, very fast form, and very dangerous. That's apoptosis we can see in case of viral hepatitis. Maybe you remember specific apoptotic corpuscles in viral hepatitis B?
Brussels. No. Oh, Brussels.
Apoptotic corpuscles in case of viral hepatitis specific, type B.
Type B.
Name.
Name बोले ऐसे बोल रहा था.
Who remembers?
Apoptotic barrel
Apoptotic corpuscles in viral hepatitis B.
Bowman नहीं था.
Councilman corpuscle.
Consilsman कौन? Yes, consilsman corpuscle.
वही क्वेश्चन पूछा.
So the pointers show you specific consilient corpuscles in case of viral hepatitis, mostly type B. Good. And also we can see multiplex hepatocytes.
ಕೆಳಗಡೆ ನೋಡಿದ್ರೆ ಅಲ್ಲೇ.
Etiology.
So, what is signs of chronic viral hepatitis? Why we can suspect the viral hepatitis? As we see hydropic or balloon dystrophy, various morphological forms of necrosis. So, in one's liver we see different types of necrosis. Lymphoplasmacytic infiltration shows us inflammation, sclerosis of the stroma, and presence of some morphological markers. So below we see chronic hepatitis B and normal liver above. That's same about chronic hepatitis type
White वाला
B.
क्या है?
You see structure of the lobules preserved, portal tract slightly deleted, the sclerosis, and some of the inflammation infiltrate you see. So pathological accumulation where you see plenty of nucleuses, that's inflammation. So that's infiltration of the leukocytes. That's chronic hepatitis type C. This is active form, but actually, another name of hepatitis type C is silent killer.
Yes, silent killer because liver disappear, I think.
Disappear without any clinic. So,
Yes.
there is some when when virus type C enters the liver, that can be like 10 years later, and we get clinic. So during 10 years, there is no any problems, not at all, and then there is clinic of acute failure insufficiency. Patient comes and there is liver is dead. There is necrosis, cirrhosis, and there is no any liver. So there is silent killer. It's killing liver very silently, without any clinic, without anything, and we get symptoms when there is late to do anything. Liver is already dead. There is chronic hepatitis type A. There is we see.
CG, what is that? Chronic
In this case, we
hepatitis.
see large infiltration. So all the plenty of more blue nucleuses. That's leukocytic infiltration. Infiltrate penetrates into levels and hepatocytes in the stages of necrosis and apoptosis.
भाई मेरा हाथ दुखा गया.
Now we move to alcoholic damage. That can be in three forms: steatosis, hepatitis, and cirrhosis. There is such scheme as we need to understand. So there is a normal liver. That's beginning. That's cirrhosis. Cirrhosis is the end. Cirrhosis is irreversible outcome. If we get cirrhosis, that's the end. Cirrhosis will never return to the normal liver. In case of steatosis or hepatitis, that's possible to return if the patient stops drinking. So we discuss alcoholic damage. Okay, alcoholic damage to the liver. If the patient stops drinking, that can, after time, will return to normal liver because hepatocytes regenerate. Liver is unique organ to the regeneration. But if we have cirrhosis, you remember cirrhosis, that's pathological regeneration. Cirrhosis, because of we get 10 more in the center, that will always have necrosis. So cirrhosis take itself by itself. So it creates some of the situation when hepatocytes always die and we get new hepatocytes. So cirrhosis is irreversible. Hepatitis, steatosis is reversible, but only if the patient stops drinking. If the patient don't stop, after time they continue more and more drinking, that's lead to cirrhosis. Same story about hepatitis. What's the difference? That's a difference how much drink. If the patient drinks not much, like some little dose, that will lead to steatosis. That's fatty change in perivenular fibrosis. If the patient drink one day like half bottle of vodka, so too much, that leads to hepatitis. That will be liver cell necrosis, inflammation, we see malarious corpuscles, and we see fatty degeneration. If in case of hepatitis we get more and more big damage, that will, repeated attacks, lead to cirrhosis. In case of steatosis, all people who drink, they have this or this form. Steatosis happens in any dose of alcohol. So if you take any dose, doesn't matter how little dose. If you get any dose of alcohol, you get steatosis always. Liver can't take alcohol and still stays normal liver, that's always steatosis. If you continue drinking to the little dose after time, that's lead to cirrhosis. If you drink some little dose and one day big dose, steatosis can lead to hepatitis. Sometimes in case of absent hepatitis can return to steatosis, but that's very rare story. Usually hepatitis returns to the normal liver. Okay.
भाई बहुत बड़ा था concept वहाँ पे तो.
So alcoholic steatosis again it happens in case of any dose of alcohol.
Thank you.
This liver calls goose liver because it's very big, very yellow. So why it called goose liver, you know? Goose liver.
उसका पैर जैसा होगा.
Like it's a very big goose feet.
मैंने मेटा नहीं किया.
Goose feet? No, goose liver. It's called goose liver because it looks like goose liver. But so goose they
It's
have
like a
such
big
and
big
yellow
lamb.
liver in normal.
No. Goose is like big. Goose is what, sir? We don't.
Okay, about goose, they don't have such liver normal. That's about goose when there is specific diet for the goose to take the liver for some meat products. And because of they feed in some specific, plenty of fats, plenty of proteins, their liver becomes yellow and becomes huge. And for some people that's very tasty. So that's why it's called goose liver, because in case of steatosis, liver looks absolutely like this. In symptoms that will be only hepatomegaly, so only increasing in size. Process reversible, outcome maybe cirrhosis. So if there is continuing of drinking. About hepatitis happens after 3-5 years of systematic alcohol consumption and can happen in case of like the first
Liver
consumption,
enlargement.
but with the big dose. Actually, what is the big dose? What does it mean? Big dose of alcohol.
Like more amount.
How large?
Daily one.
Are
3 liters.
oh, not 1 liter.
More than 300 ml.
30, 300.
That's common for everyone.
No, 2 liters.
It depends upon the immunity.
Depends on what?
It depends upon
Concentration.
concentration is
Alcohol.
yes more than
Question: there is some, I don't know, glass of wine, and the patient drinks glass of wine. He will get steatosis or hepatitis.
glass of
All
wine.
people, always.
Yes.
Undistillated होता है ना wine तो.
No, I said I said that if you take alcohol, liver can become normal. So if you take little dose, that will be steatosis. If you take big dose, that
It
will
is
be
hepatitis.
But question: glass of wine, that's big or small dose?
Small dose.
Small. For
Glass of
everyone.
wine.
Sir, age also. Age.
Age.
Yes.
Liver की
सर वाइन में
capacity.
कहाँ होता है अल्कोहल?
Wine is like it is distillated.
So that depends on something. Depends on what?
Concentration.
Depends on
Concentration of
concentration of alcohol.
yes.
So glass of wine, that's, I don't know,
Distillated.
10%.
8%.
That's big or small dose?
8%.
Small.
Small dose it is
For
like.
everyone.
No. It depends on the age.
Sir, a small glass of wine can also be dangerous.
सर depends on the
That depends on the nationality.
Nationality.
Nationality. Because in nationality, people have different level of the enzyme alcohol dehydrogenase. People at the north, they have decreased level of the alcohol dehydrogenase. That's evolution. People who live at the south, at very south, they because of the evolution, that's a very frequent story. That's like thousands of years ago, our relatives, they were eating fruits that were lying for the long time, and they have some number of alcohol because of the sun, because of the warmth, and the reproduction of alcohol in the fruits. And they were eating such fruits. So their liver, because of the evolution, was producing more and more alcohol dehydrogenase, and so they have increased number of alcoholic dehydrogenase. People who live at the north, they thousands of years ago, they didn't eat such fruits at the so that were lying for a long time, so they didn't need such alcohol dehydrogenase. So that depends on nationality. Like people who live at the north, like at the Yakutia region, glass of wine that can be extremely big dose for them. So I've read about situations like people who lived at the north, only one glass of wine, acute hepatitis and post-necrotic cirrhosis because of one glass of wine. Not even not vodka, glass of wine. So that depends on nationality. And that depends on the level of alcohol dehydrogenase. That depends on like your relative thousands of years ago was living somewhere. Because it's possible that so I live in Karelia, that it's possible that my relatives wasn't living in Karelia. So I don't know my level of the alcohol dehydrogenase. And no one knows. So that's possible that the first glass of wine, that will be extremely big dose for you, hepatitis, post-necrotic cirrhosis, and chronic liver insufficiency. Okay? So, if you take the dose of the alcohol that's big or small, that depends on the alcohol dehydrogenase, and that depends on evolution. And we don't know our level of alcohol dehydrogenase. So that's possible that you look simple single glass, and that's not a problem, but that's possible, but lead to hepatitis.
My God.
Fatty dystrophy and morphologic marker specific is Mallory's corpuscles. Also, we see necrosis of hepatocytes, neutrophilic infiltration, repair process are reduced. So that's steatosis of the liver. Another name is goose liver. That's big and yellow. That's Mallory's corpuscles, eosinophilic-like substances. That's small and large drop obesity, and also we see alcoholic hyaline and necrosis of some hepatocytes. That's alcoholic cirrhosis of the liver. So why is such surface? Because of the sclerosis and over-regeneration. That's why we get such surface. How it looks at micro. Cirrhosis. Okay, so that's chronic and progressive liver disease. Cirrhosis can't not progress. Again, there is production of some number of the hepatocytes in the center that will die, so we will get sickle to produce more. So cirrhosis always progress. Morphological manifestation that will be diffuse overgrowth of connective tissue, pathological regeneration with formation of the regenerate tunnels and falls by passage, and structural reorganization. By etiology, that can be infectious, toxic, that means alcoholic, mostly alcoholic, metabolic, alimentary, circulatory in case of heart failure, that will be cardiac cirrhosis of liver, biliary in case of cholestasis, exogenic and hereditary. Secondary can be, for example, in case of Wilson disease. What does it mean, Wilson disease? That's hereditary. Wilson disease.
Biliaries. Wilson's. Wilson's corpus.
Wilson-Connell disease.
Wilson corpus cells. Kelser-Filcher
There is a
syndrome.
deficiency of copper.
You tell me symptoms. What is the disease?
So when there is a deposition
Kelser-Filcher disease.
Cooper white. Deposition of Cooper white.
Cooper white.
so because
So there is in blood peripheral protein.
Ceruloplasmic protein.
Increased number of ceruloplasmin, Cooper great heights, brain and liver, and we get hereditary cirrhosis of the liver. Okay, morphogenesis, we see dystrophy and necrosis, hepatocytes, diffuse sclerosis, preventative regeneration, formation of valves, globules, diffuse remodeling, and deformation of the liver. By classification can be classification up to etiologic, morphogenetic, macroscopic, and clinical functional. Morphogenetic, that's post-necrotic, portal, biliary, mixed. Macroscopic forms that depends on the that depends on the size of the nodule. Small or large nodular, mixed. Microscopic, that's monolobular, multi, and monomultilobular. Clinical and functional characteristic that depends on the degree of the hepatic insufficiency, degree of the portal hypertension, activity of the process, and there is stages of compensation and then decompensation. That's micronodular cirrhosis, small nodes, same. Macronodular with big nodes, same. That mixed, we see both.
What is that? Mixed cirrhosis. Hepatitis C, macro, yellow, brown.
Alcoholic steatosis or alcoholic hepatitis, also in case of viral hepatitis.
Here front of complete.
In this case, we usually say portal hypertension.
बस बहुत हो गया नहीं हो पा रहा हाथ दर्द कर रहा है
Actually, what's the main reason of death in people in case of alcoholic cirrhosis of the liver?
Bleeding.
bleeding hemorrhage
No detox is there.
Why the patient who drink and they get cirrhosis of the liver, why would they die? What's the main reason of death in case of alcoholic cirrhosis?
damaging of
In case
liver
of portal
field
cirrhosis. Alcoholic or portal cirrhosis?
portal or alcoholic cirrhosis
And liver is responsible for metabolic
there is no
and detoxification.
regeneration stop regeneration no regeneration is another thing sir the function of the liver is like
So, portal.
portal
In case of cirrhosis, what's
कैसे आ रहा है और सर ये ऑन ही नहीं किया था हम तो ऑफ कर दिए
okay, so all what you tell, that's correct, but that's when liver absolutely don't work. And if we have like cirrhosis of the parts of the liver, that will not give us encephalopathy, not hemorrhagical syndrome, but that will be hepatomegaly, jaundice, possible, but not like always. What else?
alcohol is
This cirrhosis, alcoholic, is portal cirrhosis. Something happens with
portal no
so portal vein. What happens? Portal cirrhosis. So you remember that's three zones: pericentral, periportal. So portal cirrhosis happens close to the portal veins.
Congestion of vein.
Because of the cirrhosis, that's pressure
Congestion
on
of
the portal veins.
hypertension
Portal hypertension.
Hypertension.
What is that portal hypertension?
due to hypertension it
all the veins expand.
Okay, portocaval anastomosis.
And,
Portocaval anastomosis. What else?
abdomen
That's
varicose
anastomosis. What else?
varicose vein था,
I said ascites.
ascites, edema.
edema bro.
Edema what?
अरे वो एक था, अरे कौन उसको बोलते थे, आदमी को क्या बोलते हैं?
That's right, splenomegaly. So in
Medusa
the
head,
portal
पता नहीं
syndrome,
सुने.
we get three symptoms: opening of portocaval anastomosis,
Medusa
ascites, and splenomegaly.
Splenomegaly.
Okay, opening of portocaval anastomosis. Which portocaval anastomosis you remember?
Anterior
नहीं,
Esophageal.
Eso and Medusa.
That's right. So that's anastomosis at the lower part of the esophagus, anterior abdominal wall, and at the lower part of the rectum. That's three important zones of anastomosis. At anterior abdominal wall, we'll see Medusa's head.
Medusa head.
Actually, do we have this anastomosis in normal?
No, sir.
Yes.
Medusa head. No, yes.
Of course we have. They just don't work. We don't use them. So there is, what is mean anastomosis?
Sir,
Like
Yes,
connection.
that's connection of the veins with, what's called portocaval anastomosis?
Means portal veins and
It's inferior vena cava.
vena cava.
That's right.
Vena
That's
cava
connection
is-
between veins of vena porta and vena cava. We have the anastomosis, we just don't use them. When we have problem of the blood flow through the liver, blood congests in the liver and there is open anastomosis and blood goes not through the liver, it goes right to the vein cava because we need systemic blood flow if there is some problems with the liver. And that's anastomosis open. That's why, so we have such veins of that anterior abdominal wall, we have this, all of us has. They just don't work. When they start work, there is, we see Medusa's head because of the picture of these veins. Same story about veins of the esophagus, about rectal veins. So, what's the main reason of death of the people in case of portal cirrhosis of the liver?
Bleeding.
Bleeding of
Bleed.
what?
No.
Opening of anastomosis, then there is bleeding.
Bleeding of which anastomosis?
Portal cava. No, portal
Yeah,
not.
three anastomosis. Bleeding of which one?
So
Rectal.
this
नहीं सर को बताओ ना.
this esophagus, lower esophagus.
Is
Okay, bleeding of some of these veins. Which of them and why? Esophagus, why?
Because it's very close.
And what?
Very close.
All of these veins will be varicose. All of these veins will be varicose. Varicose, that's about deformation of the veins. Why
कौन सा
esophagus?
था वेन?
Near to the liver, first of all. That's
No.
esophagus.
अरे स्टमक भी तो उधर से रहता है and then liver
Medusa's head. Why?
due to enlargement of liver, pressure on the.
Liver is
अरे थोड़ा सा
liver पास
उसमें
में ना.
वो बोल दिया.
That's bleeding of the esophageal veins. Why esophageal? Because
It's close.
that's damage during the eating.
okay अच्छा हाँ.
So what does mean varicose vein? That's when the veins are deformed and that's very easy to tear these veins. But what about Medusa's head? They're on the skin. That's very hard to tear those veins. Hemorrhoidal plexus, that's always bleeding, but that's bleeding usually small. That's not bleeding, not dangerous. So that will be bleeding in the fecal masses and that's it. In case of esophageal veins, these veins are huge, very big, and that's very easy to rupture them during eating. So eat some meat, some vegetables, damage to varicose veins, bleeding, death. In case of portal cirrhosis of the liver, main reason is bleeding of the esophageal veins. That happens because of portal hypertension.
Okay.
Okay. Cirrhosis can be also post-necrotic, happens as an outcome of high-toxic liver degeneration. Post-necrotic cirrhosis, so we see some zones of the cirrhosis. So before that it was necrosis, now we get cirrhosis.
Cirrhosis.
Can be biliary cirrhosis, happens in case of long cholestasis because of some stones, because of narrowing bile ducts, that can be sclerosis, or because of some tumors.
Nephrologicals. Oh, primary
Primary
biliary.
biliary cirrhosis of the liver. Liver usually is huge and a bit yellow and
अरे
green.
लंबा कटी हुई है.
Primary कितना खतरनाक है. This is primary.
Complications of liver cirrhosis can be hepatic insufficiency, portal hypertension with bleeding from esophageal varices, acids, malignization, bronchopneumonias, hospitalization. So that's about portal hypertension. That's
Medusa है.
discussed. Again, we have this.
Ancilla.
They just don't work. We have those. All of us have this thing. They just don't work. and some about tumors that can be hepatocellular adenoma. Happens, hepatocellular cancers can be because of some viruses, and even without viruses, hepatocellular carcinoma can happen because of the cirrhosis itself. So alcoholic cirrhosis without any viruses, and as outcome, hepatocellular carcinoma. Liver cancer, cholangiocellular cirrhosis, cavernous hemangioma can be
Acute.
about cholecystitis. Echinococcal cyst. Echinococcal cyst. I suppose at the biology you discussed about echinococcus, right?
Pneumococcus
That's animal
cyst.
parasites. Around this we get granulomatous inflammation. What's danger about this cyst? That can be huge cyst that's destroy the tissue of the liver. Another problematic moment is about deletion of this cyst. If we damage this cyst in somehow anything, there is so that's animal parasite. That's extremely different biological substances in us. If we damage some cyst, in any case, this thing go to the blood flow and cause anaphylaxis, anaphylactic shock, death. So that's very hard to delete all those cysts. That's metastasis to the liver, metastasis of melanoma. Can you show me where is metastasis from the melanoma?
Metastasis from the
Where is
melanoma.
metastasis from the melanoma?
Metastasis. Red.
Sir, there.
Metastasis is
Sir,
No
there is the red.
metastasis to the liver.
Sir, the red one. Sir.
Red.
The red. From the red one.
Right.
Yes.
This one.
Yes, yes.
But it is benign.
Melanoma? Benign?
Mole.
melanoma.
There, sir. The red.
This is metastasis.
Yes, sir.
The red one.
Yes.
Why red?
Due to change.
Why red?
Why red?
Blood will be red.
Red is red.
Due to
So you think that metastasis is red one? Why red?
Because hematogenous metastasis.
And what?
due to
In
like
such logic, all hematogenous metastases shall be red, but they don't.
hematogenesis, like accumulation of blood and bleedings.
The whole liver is metastasis. You think so? All liver metastasis, everything.
No.
So maybe whole.
Sir, it is the entry. No.
Huh? So red
There
is
is
not. Red is some vessel.
helium of four. The yellow triad is there.
Yellow parts.
Are
Are-
Like you need this little zones, right?
No, ये
So
black one.
that is metastasis.
Sir, black one is metastasis.
No, sir.
Where is black one?
Whole.
होल
You think the whole liver is metastasis?
अरे नहीं होल नहीं
जो ठीक से दिख रहा है वहाँ से स्प्रेड हो रहा है जो वो लाइन देखो मैं जो
So that's a yellow part.
तुम्हारा आवाज जा
That's
रहा है इसमें
तो वो तो
Tissue. Normal tissue.
normal tissue.
Oh, hi.
That's normal tissue and that's all metastasis?
Yes, sir.
That's right.
Huh?
This is normal tissue. That's right. And everything black you see, all
Is
black
ma-
zones
is
are
is matters. Oh,
Melanoma. What's melanoma? That's tumor of the melanocytes.
black in color, black
So
pigments.
all black you see, that's metastasis of melanoma. And yes, liver is all in metastasis.
क्वेश्चन सर वो रेड वन क्या है रेड वन
Red one is the vessels.
Vessels. गैस गलत
एक और